My name is Kim Hirsch. I'm the Executive Director of the Jewish Community Foundation of Greater MetroWest, New Jersey. We are the planned giving and endowment arm of our Jewish Federation. And welcome to our 6th of a 7-part series, Greater MetroWest Response to COVID-19. The topic today, is, as you can see, is mental health. I'm delighted to be welcoming an amazing panel today. Sarah Mendez-Emma, who's a Director of Clinical Services at Jewish Family Service of MetroWest, Rabbi Daniel Geretz, one of our chaplains with our chaplaincy program of our Federation, and Becca Wenetic, who is our Manager of Community Inclusion and Program Services of our Jewish Federation. I'm just going to say a few words and then we'll bring on the first panelist. I did want to say I have never been more proud of being part of our JCF and our Federation than in the last 6 months with our response to this crisis. Doug Ben-Shimon, our CEO, likes to say we are here today because we were here yesterday, and that is so true. In this crisis, it's because of the infrastructure that we have and the leadership, both lay and professional, the departments, all of our the annual campaign, the whole structure of Federation has made possible our incredible response to the COVID crisis over the last, no, somebody's not hearing me, so sorry, over the last 6 months or so. To date, our Federation and Jewish Community Foundation together have granted out more than $5 million. This is from annual campaign, Federation emergency reserves, supporting foundations, advisory councils. So a huge amount of money to support the needs in our community here, locally, and nationally, and around the world. We've never really had a moment like this of crisis where, many of our crises over the last, in recent decades have often been about the other, whether in Israel or in different parts of the world. This COVID-19 crisis has really been not only about the world, but really our community, right? Literally every single person in our community has been impacted in some way, and we have been there in many ways to help. And I just wanted to mention also that this series is being run through our Center for Strategic Philanthropy, which you'll hear more about at the end. So over the past 2 years or so, our Federation has put a greater emphasis on mental health. Our Federation's ABLE department, which is headed by Becca, convenes and collaborates with our partner agencies in the community who support and advocate for people with disabilities and their families. And part of that work has been sharing best practices and identifying gaps in services that we can fill. And then in recent years, one of those gaps that we've seen, and particularly in this crisis, has been work in mental health awareness and efforts to highlight and enhance the services that we have in our community and how can we expand on them. In terms of chaplaincy, we have a nationally recognized chaplaincy program that's run in partnership with hospitals throughout Greater MetroWest. We are providing spiritual care, at all times, but in the COVID crisis, this really highlighted the chaplaincy program in new ways. Even when patients were in isolation, our community members continue to receive spiritual counseling and visitations. As one of our chaplains said, when we see the fire, we don't run away, we run into it. Our chaplains have been there every day for families going through the unimaginable, as well as those hospitalized for non-COVID treatment, and stress levels were and of course remain high, and our chaplains continue to step up to that challenge, supporting patients and their families, and also doctors, nurses, and healthcare teams. So with that introduction, I'd like to introduce Sarah Mendez-Emma with some words, a presentation on Jewish Family Service.
Am I up and running? I see, there we are. Hi, everybody. Thank you, Kim. I just also wanted to say a quick thank you to the Federation and to April and for JCF for having me here today to talk a little bit about the services that JFS is providing to our local MetroWest community. This first slide here is just talking a little bit. I want to share for a few seconds just about the services that we provide in general. And I wanted to let everybody know about our active involvement even without the COVID crisis and who we are working with and who we are a part of. And so as you can see, we are actively involved. We're a community-based service agency. We work out in the communities. We work out at our local temples and synagogues. We work at our local JCCs. We are at the Goddessman Hebrew Academy. We are over at the local day schools, and we're also actively involved in a lot of the local synagogues, as you can see. And I put a couple of these up here because since we have started, we have been a part of the MetroWest community for so many years. But a lot of the work that we've been doing for the last 100 years or so has been on mental health. And we are not only a community agency, but we are an outpatient mental health providing agency. And when the COVID crisis began in March, we really had to switch and change the types of services that we were providing to the agency. As many of us have gone, Yafa, you can change the slide. Since we started in the beginning of March, JFS really had to kind of change and react. You know, normally we were seeing clients on a daily basis. They were coming into our office. We were providing groups. We were providing support in our local homes and our residencies, and that all had to change when we couldn't be face to face with our community members anymore. And so since we started in March, we decided that we wanted to offer as much support as we possibly could to as many people as we possibly could, which is not so easy when we're stuck home. And so these are just a glimpse of some of the groups and programs that we have been offering since March. And you can see we've been working with our older adults, we've been working with parents, we've been working with clergy, we've been working with family members in schools. We've been working with individuals who have either lost somebody to the COVID, to coronavirus, or if they've had somebody experienced it. We've been trying to work with healthcare workers and help them deal with the PTSD symptoms that they could be experiencing. And so I have, one statistic that I just wanted to share about the kinds of groups. We've always been somewhat of a group providing agency, but since March alone, we've provided over 240 groups, and attendees in those groups are almost at 1,200 people. And so that's just a little bit of a glimpse of this COVID specific programming that we've been able to provide that we weren't doing before March. On top of that, we have close to 30 clinicians who have been providing weekly, if not multiple times during the week, individual therapy services for all of our clients. One of the things that we've become an expert in is Zoom, and that is not something that we've necessarily done before. If you can see, we've had to start to change the type of work that we have done. Although we've always focused on mental illness and mental health and helping our community members recognize how to take care of ourselves during this pandemic, it's a different experience. Is my Toy Story picture over here expresses, I think, the amount of stress that every person has been experiencing during these last 6 months, 5 to 6 months, has really, just gone over and over the amount that what we're used to going through. On top of that, us as therapists and as, mental health agencies, but also as community partners and fundraisers and programmers, we're not usually experiencing a shared stress level with our clientele or our community members. Usually we've either gone through it in the past or we could talk about it, but to be in a moment of stress and anxiety at the same time as the people that we are working with has really kind of changed our outlook. And so this picture about putting our, the airplane oxygen mask on first is one of the important things I think that we need to be able to remember to do, in the sense of how do we take care of ourselves? In our individual sessions, we've been working with clients to help them recognize, to take care of their families, to prepare for school, if they're teachers, if they're workers in the health care field, if you're working trying to fundraise and trying to get us money. We need to be able to take care of ourselves so that we can share and so that we can take care of others. But that's a lot to handle. And so, the work that we've been doing has been really focused on validating, right? And sharing our experiences and recognizing that there is a lot for everybody to handle. And we have to learn how to compartmentalize and how to feel safe in our current situations. And it's not been easy for a lot of people, but it's also been a very normalizing experience, which we hadn't had before. And so I think to know that you're not the only person going through a very stressful time has been helpful, I think, for a lot of our clients and a lot of the community members that we've been working for. And, you know, I just, you know, one of the things that has happened, which I think is par for the course, as I just saying, everybody has had an increased stress level. I have my little please wait up here, and that's actually in reference to our wait list. We have struggled to be able to meet the needs of all the community, although we're trying to do the groups so that we can hit more people all at once. Our wait list for individual clients has gone through the roof in the last few months. And I think that's par for course. And we're in the process of trying to hire more telehealth therapists so that we can see clients and get them more actively involved and help meet their mental health needs. But I think one of these struggles that we continue to deal with on a day-to-day basis is, you know, there's this quote here from Brene Brown, who I love, is that a connection is the energy that exists between people when they feel seen, heard, and valued, and when they can give and receive without judgment, and when they derive sustenance and strength from that relationship. And so as therapists, we and as people, as humans, we need connection, we need relationships, we need to be with other people. And that's been a real challenge, as you know, many of us in this mental health world are not used to working behind a screen. We're used to being face to face with people. And so as you can see me, I can't see you, and I don't, you know, and I think that's been a challenge that we've all kind of had to learn how to deal with. And so as we continue to try to support and provide more services to our local agencies and to our local community members, we all have to be able to recognize that we have to adapt and move forward with what's available, you know, what we have control over and what we don't have control of. If anybody has any questions, I saw that a couple things had come up. If you are welcome to call me, or to, you know, I think I can send out my my email address at the end too, to see if there's any services that we can be helpful to provide. I'm happy to answer questions or talk through any other services. If your, you know, local community members are looking for stuff, I'm happy to also kind of come up with some ideas and brainstorm with you for that.
Thank you so much, Sarah. And I know that our entire community is so grateful for what Jewish Family Services is doing. I know you guys have been going above and beyond all these months, and we'll come back with some questions after. And now I'd like to bring on Rabbi Gerritz to talk about chaplaincy. Thank you, Rabbi.
Thank you. First of all, I want to thank Federation and JCF for organizing this series of webinars. And I also want to thank all the people who are attending today for giving us of your time, which we know is valuable. Jewish tradition is rich with narratives about spiritual struggle. For example, Jacob and Esau's struggle is as much a spiritual struggle as it is a sibling rivalry. If you like, I could tell you more about that in the Q&A later on. As a chaplain, I'm trained to assess individuals and identify their spiritual struggles and crises. As a rabbi, I often do this through the lens of our tradition. I also help individuals to explore ways they can continue to find meaning in their lives despite those struggles and crises. Last month, I visited a patient who has suffered from bipolar disorder for most of her life. While she saw a psychiatrist periodically to help manage her medication, she had not seen a therapist for quite some time. As we spoke, we identified a number of losses in her life, including having given up a newborn daughter for adoption. Her isolation due to pandemic and her loss of control due to hospitalization served to heighten her sense of loss. During the visit, the subject of gift giving came up, and I asked how she felt about getting gifts from other people. She said she preferred to give gifts rather than getting them. This led to a discussion about whether she felt worthy as an individual and capable of reaching out for help or caring for herself as she might care for other people whom she loved. The patient I visited was struggling with feeling unworthy of self-care. This sort of spiritual struggle can have a profound effect on mental and physical health. I suspect that, like my patient, many of us have been wrestling with how to continue to engage in self-care and maintain a sense of community in the face of pandemic, the resultant isolation, and the changes we have witnessed and experienced. COVID-19 has really challenged me to focus on my own self-care as a chaplain and to revisit the fundamentals of chaplaincy. Until the pandemic, I did not realize how much I depended on physical presence, body language, and facial expressions and touch, including hugs, to help myself to be emotionally present during a visit. The pandemic has stripped me of a lot of this, and I've had to work hard to remain emotionally present, even on the phone or on Zoom. I've also started to interact with patients' families much more, especially when patients are intubated or not otherwise able to communicate. I reach out to families to let them know I visited their loved one and to check in and see how they are doing. Pandemic has heightened people's sense of isolation, particularly in April and May, when people went to the hospital. They did not know whether they were ever going to see the families that they left at home. Other patients who might benefit from a family advocate or even just social cues to remind them that it is time to eat suffered due to isolation. Hospitals sometimes feel frightening or disorienting, and the isolation due to pandemic can heighten those feelings. COVID-19 has also had dramatic effects on practitioners in the hospital who may have been reassigned to different units and or different responsibilities, and they suffer the effects of witnessing so many people being isolated and sometimes dying alone. I sometimes serve as a surrogate family member when no others are able to come into the hospital. Early on in pandemic, I served this function for a man who was in the ICU with COVID-19. He was intubated, in organ failure, and slowly dying, and his family at home had also tested positive for COVID-19 and feared that his journey was a harbinger of what the rest of them might experience. I stood outside the patient's room in the ICU, FaceTimed the family, turned around the camera so they could see their husband and father, and sang a chapter of Psalms and a prayer for recovery. At the family's request, I also recited the Vidui prayer on behalf of the patient and affirmed his love for them and their love for him. Ultimately, through this visit, I ministered to the patient, to his family, and to all of the staff in the ICU who observed. I come from a background in technology management, and I've become the tech go-to person for my department. For example, I help with video editing, training people to use technology to connect with patients and their families, and customizing department reports to include bedside phone numbers and emergency contact information, which we didn't need, or we didn't realize we needed prior to pandemic. My wife, Jennifer, and I both started as Federation chaplains in February of this year. Although we had both worked as chaplains prior to then, COVID-19 is the only normal we have lived with in our present placements. In the early weeks of the pandemic, Jennifer and I looked at each other over dinner and said, "Looks like we picked the wrong week to stop sniffing glue." Since then, we've had a number of conversations about continuing our work. Speaking only for myself, I suspect that God has called me to be where I am right now, and I continue to visit hospitals despite my concerns about personally contracting COVID-19. As part of my self-care, I've acknowledged my fears with my contract clinical supervisor and with my direct report at the hospital. I thank you so much for spending the time to listen to all of us today. Thank you.
Thank you, Rabbi, for those really kind of heartrending and very, very important stories for us to hear. And it's a reminder not only that COVID affects the patients, but also each of us, so those who are caring for them and everyone in the community. And I would also say, boy, to have techno rabbi chaplain around is super helpful these days. So thank you, and thank you for joining us and all the work that you do. Now I turn it over to Becca Winetic with our Federation Greater MetroWest ABLE program. Becca, take it.
So good afternoon, everybody. Thank you to JCF for coordinating this important conversation about mental health. Thank you to Sarah and Rabbi Garretts as well, who have shared their work in supporting our greater community. I think it's really important for us to remember that everyone experiences mental health struggles from time to time. And especially during this COVID crisis, it has become evident that there is a greater need to better understand and recognize our own self-care skills and how to support one another and get help for those in need. As Kim had mentioned at the beginning, Jewish Federation's department, Greater MetroWest ABLE, works together with our partner agencies to share best practices and identify gaps in service that we can work together to fill. Over the past several years, one of the gaps that we've identified is to raise awareness about the mental health services and supports, as well as to educate about self-care skills and build resiliency in our teens. Our JFS agencies do an incredible job providing the boots on the ground work around supporting individuals. We recognize that there's also a value to offering additional opportunities to raise awareness of these services and how people can better support one another. So we seek to highlight and enhance the services that are provided to our community through our JFS agencies. Greater MetroWest worked specifically in collaboration with Greater MetroWest ABLE worked specifically in collaboration with JFS MetroWest to develop a mental health resource guide for our Greater MetroWest Jewish community. This guide is also available online on our Greater MetroWest ABLE website and in printed format. We're really proud to have this resource shared and utilized by families and professionals across the Jewish community, from Bergen County to Southern New Jersey. In addition to this guide, Greater MetroWest ABLE sponsors a couple of mental health awareness programs. Here Now, Greater MetroWest, which is on your screen right now, is a teen-driven movement to build connections, increase well-being, promote mental health awareness, and engage in conversations about social pressures, relationships, anxiety, substance use, and other relevant topics to teens. Bringing teens together to learn and support each other is a powerful way to help reduce stigma and to educate about the value of mental health. This program originated at the Jewish Board in New York, and Greater MetroWest is actually the first pilot community to host the program, and we're entering our second year now, far surpassing our goals for year one. In surveying some of our recent participants, we found that over 91% of the teens reported gaining new self-care skills. More than 54% of the teens expressed an interest in participating in leadership roles moving forward. And 73% of them had felt like they had begun to form new relationships with the peers that were in the group. We are incredibly grateful to JCF for providing the initial funding to be able to bring this program local to our teens. The other program that we've implemented the last few years is the Youth Mental Health First Aid Certification Program. It's an international program that teaches people how to identify, understand, and respond to the signs of mental health challenges and substance use disorders in youth. This training gives adults who work with youth the skills that they need to reach out and provide initial support to children and adolescents to help connect them to the appropriate care. Just like a typical first aid program would for medical interventions. And I know many of us have taken first aid before. So we've been offering this training locally for the past 2 years to over 50 professionals in Greater MetroWest, including educators, youth advisors, clergy, camp professionals, and lay leadership. During this COVID crisis, these community professionals and lay leadership recognize the need to support our children and teens as they navigate the drastic changes to their environments. So this year, we're training 16 professionals in our community who will then serve as trainers in our Jewish community, being able to train dozens more across Greater MetroWest in the year ahead. I'm incredibly proud to have professionals from our day schools, Jewish Federation, JCC of Central New Jersey, and our JFS agencies who will be participating in this 3-day trainer certification program initially. One professional participant from this past year shared recently that she put the training to good use. She had a teen at one of her programs who was overwhelmed after sharing a personal experience. She sat with her and was able to reassure her and redirect her using the skills that she had learned through the training. She was grateful to have had the training in youth mental health first aid to help her through that moment. So if your congregation or you are interested in hosting an upcoming training, please let me know. We will certainly have trainers available beginning in November. And Greater MetroWest Able continues to plan forward and will continue to support our Greater MetroWest community through this COVID crisis and beyond. We work together with our partners from our agencies, synagogues, and schools to best meet the needs of our community. Thank you.
Thank you, Becca. Thank you. It's very, very helpful and informative to hear about these great programs. I'm now going to welcome questions. So please put those in the Q&A or the chat, either way. We'll see them. And we're going to bring all of our panelists on. I have a couple questions already, so we'll get started. And if anyone wants to add questions, again, please just put them in the Q&A. So do you want to share perhaps an uplifting story about one of the clients and how they benefited from your programming during COVID? I don't know, Sarah, maybe you want to share a story?
Sure, I can share a story. I have, I think the continuation of services for specifically our children has been a huge impact. I have a young child who I've been seeing for over a year who is about 6 years old, and normally we would do play therapy, right? And so to do play therapy via Zoom is tricky, to say the least, and to not to necessarily be in that, like I said, that face-to-face context. And so what we've been doing is art. And each week, this child has had a sense of control, a sense of ownership. She directs me to every line, every color, every put the green grass here like this along the bottom of this page. And we've developed this rapport through Zoom of her having this sense of ownership over what's going on in her life. A few of the pictures that we've drawn are her house. And 2 weeks ago, she actually drew a picture of our office, including the front staff, right? The woman who opens the door and takes the insurance and says hi to her. And then it's me walking down the hallway with her family member and going into my office was this long picture. And so talking about expressing herself via art in a way that we would not normally do, or we could do, but in this different sense about missing our traditional and our old ways of being together, but still allowing herself to be able to express her feelings and her emotions in a safe way and to kind of get it out and talking about how we miss things and how we miss each other and how we can't wait to see each other again. So I think that's a good example of the work that we continue to do, even though it's not as perfect as we would like it to be.
Right. Okay, thank you. No, it's important for us to hear these stories. I don't know, Rabbi, if you want to talk about the chargers that our chaplains brought to the hospitals. I mean, I think that was a really nice addition that we had. We were able to bring phone chargers to families, or another story.
So, sure. It actually wasn't my idea.
That's okay.
Jennifer is at a different hospital than I am. And she said, people are coming in to the ER. They're coming with their cell phones and they're forgetting their chargers and there are no visitors. And so it's really hard for families to stay in touch with their family members. The hospital has courtesy chargers in the waiting rooms, but they don't have a supply of chargers. So she put together a request, and I don't remember the details. I believe through Federation, we basically solicited a request for donations. There was somebody who had spoken to her at the hospital and had said, I want to do something. I want to sew masks. And they were at a point where they were saying, like, we're not taking hand sewn masks now, but if you can donate chargers, we'd really appreciate it. People would come and leave, boxes of chargers on the porch. And we probably provided somewhere in between 40 and 60 chargers to a number of different hospitals to have available. So if somebody says, hey, you know, my phone is dead and I have no way of charging it, we can bring it up to them and they have something.
Right. Now it was beautiful. Actually, it was just a simple charger. And by the way, they were donated by our Younger Leadership Division, our next door division of Federation. People who were sitting at home saying, I want to do something. And they handed in these chargers and we got them to the hospitals. And it was a lifeline for some people, right? To be able to be in touch with their families. So it was a nice moment. Becca, do you have, you know, one story that's special to you about something, you know, positive?
I think one of the things that's been really nice about the Here Now program is that even beyond the monthly workshops that the kids are doing, they're continuing to connect with one another and connect with the coordinator. So the coordinator of the program was touching base with them throughout the summer, throughout this COVID crisis, just checking on them and their families, and that they, you know, they recognize the value of supporting one another and sharing their experiences. So they're excited to begin again in the fall.
Right. So good that they had the program before the crisis, you mean, and then they had that connection.
Connection with one another.
Right. No, that is great. Are they in touch with each other, the teens? Like
some of them are. Yeah,
right.
Some of them are.
Right. No, I'm sure that would be super helpful too. One more question. What are your, you know, biggest concerns in the months ahead? I don't know, maybe again, we'll start with Sarah. Obviously this crisis is continuing, so.
I think, you know, as we are a family service agency, school, right? We work with schools, we work with families, we work with children, and the living in the what are we going to do tomorrow is the challenge. You know, we were meeting yesterday talking about how can we support the schools, how can we support the pods that are being created in this world, right? How can we support the parents who are saying, do I keep my kid home, do I do this, what do I do, what's best for me, what's best for my child? And the struggle is, I don't know, right? We don't have the right answer. Nobody has the right answer. And so I think our challenge is, how do we support and just help people sit with this level of increased stress or anxiety? And it's hard, you know, and I think that's not going away, because even if they know what they're going to do September, it may change, right? It's going to change in October or November or December or January. You know what I feel like? We're living in this constant state of fear and worry. And so, you know, that's the challenge I think that we're all going through right now, not just those that are ill or mentally ill or anything along those lines.
Right. I'll just add to that. I happened to be sitting with one of the heads of school of our Jewish day schools yesterday, and I said, what's your plan, your reopening plan? He said, well, as of 2 o'clock today, here it is, and it will probably change by tomorrow. And then he said, my parents have to get used to that idea that it's going to change 6 times before we reopen, and then again. And I was thinking about the parents and the children and
what the teachers, right, and the support staff and the principals, all of them.
Right. So not just for the professionals, but the whole.
Everybody's involved in this. Yeah.
Right. Exactly. Rabbi, your concerns in the coming months?
I'm going to second like the school concern, and I think it's part of a bigger concern, which is, you know, there are so many things to be anxious about now. Mm-hmm. For those of us that tend to be high-strung, anxious type people. I think, you know, I Googled when you asked the question, choosing how to channel that anxiety and figure out like what's worth being anxious about and why am I anxious about it and what can I do about it. I Googled the Serenity Prayer, which some people may be familiar with from 12-step programs, actually written by an American theologian, Reinhold Niebuhr. God grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. We're used to living in a world where we have a lot more control than we do now. And being able to go through this as a non-anxious presence is a real challenge.
That's just to correct me if I'm wrong. That's the alcohol anonymous.
Yeah, it's all
of us now, right? Okay, yeah, okay. I've definitely heard that many times before. Thank you. That's really helpful. Becca, you want to close us out with some thoughts, and then I'll close the seminar. Thank you.
Yeah, I mean, the schools were definitely the top of my mind as well. I think that, you know, we have educators and parents that are really struggling with what the right thing to do is. And similar to what you said, Rabbi Gerritz, I think about it's so important for us to recognize how we're feeling ourselves and to have that awareness that everybody around us is also struggling in this time. This COVID crisis has really brought to light the fact that everybody has mental health challenges at different times. And the stress and the anxiety through this crisis, I think there's just a greater awareness that people are not sitting alone, but that this is something that's affecting all of us, and to exercise patience and understanding through that with our parents, with our children, with our educators and clergy, because we're all experiencing this.
Okay, thank you. Those very wise words. Thank you to all of you. Thank you, Becca and Sarah and Rabbi Gerritz, for your really, really informative and important presentations today. This, as I mentioned, was the 6th of a 7-part series. The last webinar is going to be Israel and Overseas, and that will be on August 27th, again, the same time, noon to 1. Please, there was a survey that just came up, so we ask you to please fill out that survey. It's take you 3 seconds. I just want to say a few words again about the Jewish Community Foundation Center for Strategic Philanthropy, the sponsor of these webinars. We engage with our fund holding families on philanthropy. We educate, like today, we educate on what's going on in the community, and we also innovate. We have an innovations fund. I know some members of our innovations fund committee are on this call. Through our very special relationship, with Federation and being part of Federation, we are able to really bring to you, up to the date information, up to the minute, and really informative information about what's going on in our Jewish community, as we did today. So thank you for joining us. I wanted to also just mention our JCF will be restarting our Donor Advised Fund Synagogue Incentive Program this fall in the coming weeks. And basically, if someone opens a new donor advised fund with our Jewish Community Foundation, our JCF will make a $100 gift to that person's synagogue, the synagogue of your choice, or to Federation in your name. So I know if you know folks in the community who might be interested in opening a DAF with JCF, please be in touch with us. You'll get a follow-up email from Yafa Karp with information on this webinar, and you can just follow up with Yafa. And with that said, thank you. Thank you to our wonderful panelists, and thank you to everyone for joining us today. Be healthy and safe.